My name is Dr. Stephen Chavoustie. I'm a board-certified obstetrician gynecologist. I have a faculty position at the University of Miami Miller School of Medicine. I'm a principal investigator on multiple clinical trials studying drugs on prevention and treatment of uterine fibroids. So the question is, who develops uterine fibroids? And this is a question that is somewhat difficult to answer because you could have someone who never had a family history of it, but more commonly uterine fibroids present in black women, 70 to 80% incident over their reproductive lifetime. 70% of women overall, white women, will develop uterine fibroids. There's probably a genetic component to uterine fibroids, and we see this. Women that are obese, these women may produce more estrogen than someone who is of normal body weight. Women that have never had children may be at increased risk for uterine fibroids. Women who have uterine fibroids, we classify them into two types: symptomatic, which means they have symptoms, and asymptomatic. Asymptomatic women obviously have no symptoms. They're not having heavy bleeding. But women that are symptomatic with uterine fibroids suffer from heavy bleeding, irregular bleeding, or what we call abnormal uterine bleeding, pelvic fullness, which is what we call a bulk effect. Some women can have heavy, painful periods, what we call dysmenorrhea. Some women can also have infertility, primary infertility or secondary infertility because of uterine fibroids. If the fibroids are pushing on their bladder, they can get urgency and increased frequency of urination. If it's pushing on their rectum, they can actually have constipation or symptoms of feeling like they're constipated. So these are the majority of symptoms that we deal with uterine fibroids. Currently, the thought behind growth of uterine fibroids is the natural body estrogen production. And this is why you see fibroids in women who begin their period and women who stop their period, the fibroids stop growing. So it's obviously estrogen production. There's some thought about progesterone production and some thoughts about growth hormone production. Currently, there's no way to prevent uterine fibroids. There's no medical treatments to prevent or surgical treatments to prevent uterine fibroid growth. The question is can uterine fibroids prevent a woman from getting pregnant or infertility? And yes, women who have uterine fibroids, depending on where they're located in the uterus, can have either primary infertility, which is where they've never been pregnant, or secondary infertility, where they might have had a pregnancy and a delivery, but now they're suffering from effects of the uterine fibroid. And it really is based on where they are located in the uterine cavity, or if they're pushing on the fallopian tubes, and possibly inside the uterine cavity, which may actually block the implantation of a pregnancy. So the question is, can fibroids turn into cancer? And yes, we know now that fibroids can become cancerous, what we call a leiomyosarcoma. And there's an incidence of this occurring, especially in women over the age of 40, of about 1 in 350. And it's been reported in the literature when women were having procedures called morcellation procedures, where we went in there to remove fibroids through a laparoscope. And when we cut up the fibroids or morcellated the fibroids, about 1 in 350 had uterine cancer. There's multiple modalities of treatment for uterine fibroids. We could start one with surgical treatments. We have laparoscopic procedures, we have a hysteroscopic procedure, and it depends on where the fibroids are located. We can do a procedure called a myomectomy, where you go in there and just remove the fibroid and spare the uterus, and this is a procedure for women that want to preserve their fertility. If a fibroid is inside the cavity of the uterus, we can go in with a procedure called a hysteroscopic myomectomy, where we actually remove the fibroids through the cervix with a relatively pretty simple procedure. Women are back to work within 2 days. We can also go in there and recommend a woman, if she's got symptomatic fibroids and conservative treatments have not helped, women can be offered hysterectomy, which is actually definitive treatment. There's other procedures. We can actually do an ultrasound, which is a high frequency ultrasound ablation, which is a radiologic procedure. There's a procedure called a uterine artery embolization, where, very similar to a cardiac catheterization, we thread a catheter into the uterine arteries and then we actually send little glass particles which sclerose or obliterate the blood supply to the fibroid. That's called a uterine artery embolization. We also have medical therapies to offer patients. If a woman is having heavy vaginal bleeding, we can offer them progesterone, possibly a progesterone shot. We can offer them birth control pills. And ironically, we can also offer them a progesterone IUD, intrauterine device. And this really is very beneficial for women that have heavy bleeding associated with fibroids. There's currently drugs for taking women that have heavy bleeding in preparation for surgery, and these are drugs called GnRH agonists. Drug has been approved for almost 28 years, and there's current medical drugs that are in development that we are using to stop the bleeding associated with heavy uterine bleeding. And these are drugs that are used not necessarily to treat the overall condition of fibroids. They're used to treat the heavy bleeding so we can stabilize someone, say, who is anemic, or stabilize someone who is going to the operative room to have a myomectomy to get their blood counts up. So these are the modalities for treatment: surgical, radiologic, and medical treatment.